Hello everyone, hope you all are staying safe at home. I am Aaliya Syam and studying in 1st standard VNSS Center School, Cherthala. I will talk about a pandemic which is the defining global health crisis of our time and the greatest challenge we have faced since World War II. Coronavirus disease, which is also called as COVID-19, is an infectious disease caused by a newly discovered coronavirus. Most people infected with the COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. Older people and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease and cancer are more likely to develop serious illness. The best way to prevent and slow down transmission is be well informed about the COVID-19 virus, the disease it causes and how it spreads. Protect yourself and others infection by washing your hands or using an alcohol-based hand wash frequently and not touching your face. The COVID-19 virus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. So it's important that you also practice respiratory etiquette. For example, by coughing into a flexed elbow. At this time, there are no specific vaccine or treatments for COVID-19. However, there are many ongoing clinical trials evaluating potential treatments. World Health Organization will continue to provide updated information as soon as clinical findings became available. We talk about the symptoms now. The COVID-19 virus affects different people in different ways. The COVID-19 is a respiratory disease and most infected people will develop mild to moderate symptoms and recover without requiring special treatment. People who have underlying medical conditions and those over 60 years old have a higher risk of developing severe disease and death. Common symptoms include fever, tiredness, dry cough. Other symptoms include shortness of breath, aches and pains, sore throat, and very few people will report diarrhea, nausea, or a running nose. People with fever, cough, or difficulty breathing should call their doctor and seek medical attention. Now, I will talk about the prevention. To prevent infection and to slow transmission of COVID-19, please do the following. Keeping social distancing is the best prevention for avoiding the spread of this virus. Observe good personal hygiene. Wash your hands regularly with the soap and water or clean them with an alcohol-based hand wash. Maintain at least 1 meter distance between you and people coughing or sneezing. Avoid touching your face. Cover your mouth and nose when coughing or sneezing. Stay home and self-isolate from others in the household if you feel unwell. Throw used tissues into a closed bin immediately after use. Refrain from smoking and other activities that weaken your lungs. Practice physical distancing by avoiding unnecessary travel and staying away from large group of people. So, we all will ensure to follow these preventive measures to wipe out this pandemic from this world forever. Keep one thing in mind, prevention is always better than cure. Thank you all and be safe and healthy.